Support for Radio Friends comes from La Brunerie Financial, where they work to ensure a lifetime of financial security for people from all walks of life, from investment services to retirement plans. If you're looking for a trustworthy company that has the experience and knowledge to put your interests first, contact La Brunerie Financial, a community-based investment counseling firm since 1966. Good morning and welcome to Radio Friends on Monday, February the 7th. I have Dr. Jeremy Johnson with us from the Truman VA Hospital. Pleasure to have you here, Doctor.
Thank you, Paul, for having me again.
We're going to talk about sleep apnea. And I'm learning a lot more about it while we were waiting to go on here. One way of determining sleep apnea is if your partner notices that you stop breathing at nighttime when you're asleep, or if you're snoring. But now when you said snoring is a sign that you could have sleep apnea, my response to you was almost everybody snores. Does that mean almost everybody has sleep apnea if you snore?
Yeah, that's a great question. And we know lots of people in the general population snore, but not everybody snores. And for sure, there are what we call simple snorers, or all they do is snore, and they don't have obstructive sleep apnea. But what we have to realize is that snoring may be a warning sign that a patient could have obstructive sleep apnea. And so you're right, a lot of times the patient presents not because they have a complaint, but because their bed partner or their spouse has witnessed them snoring and it bothers their sleep, or the bed partner has witnessed that they stop breathing during sleep or their breathing gets shallow. And so those could be some of the common ways that patients present. We also know that people may choke or gasp in night and awake with arousal, coughing or choking and trouble catching their breath. And so they may know that, or their bed partner may know that. And some people live alone, and sometimes it's when they get with family and other family, maybe even the room next door or a couple rooms down, hear them snoring loud. Some people describe you were snoring so loudly, and probably the louder the snoring, the more of a warning sign it may be, or the more alarming it may be. And we know that if we don't have a diagnosis of obstructive sleep apnea, or if we fail to recognize this and fail to treat it, that it could be a deadly consequence long-term if we don't treat severe sleep apnea.
Okay. Now, you were telling me that one warning sign of sleep apnea is if you're snoring and then you stop breathing for a couple of seconds. Is that right? But then I asked you and you said, well, it's normal people can stop breathing as many as 5 times an evening, and that's okay, 5 times a night.
Yes. So
how do you know if it's overly?
Yeah. So you don't have to have snoring and somebody witnessing stopping of breathing during sleep. It could be either or both. But once we see those warning signs, a patient really needs what's called a diagnostic sleep study. And we could do that several ways, a sleep study. But we look at We study them across, 6-7 hours of sleep overnight in a sleep disorder center.
So you have to go in to do your sleep study.
Yeah, historically that's always how it's been, an in-lab, what we call an in-lab study. But now we also can do home sleep apnea tests, and so we do have a test that can be done at home. But to finish your point about we look for what's called apneas, and that's where a patient quits breathing for 10 seconds or longer. There's no airflow at their nose or mouth for 10 seconds or longer. So that would be one. Or we have another respiratory event called a hypopnea, where their breathing gets shallow, so their breathing drops by 50% for 10 seconds or longer. And so we count all those across the night, and then we divide by the hours of sleep. And so the number that you referred to, 5, is we can have up to 5 apneas or hypopneas per hour, less than 5, and that's considered within normal limits. But when we start seeing an apnea-hypopnea index, or these respiratory events more than 5 an hour, then that would confirm a diagnosis of obstructive sleep apnea. And it's when it's above 15 an hour, that would be moderate sleep apnea. And when they're above 30 events per hour, that would be what we call severe. And what we're really worried about is identifying the people that have moderate or severe sleep apnea, or even very severe sleep apnea, and treating them, because we know that they can have a whole host of medical issues and problems if we don't treat them.
So how do you treat the sleep apnea then? By wearing that Cpap machine?
Yeah. So currently that's the gold standard, the best treatment, the treatment that's been the most studied, the most validated, that we can resolve sleep apnea with
So you
Cpap.
put this mask on your face, and you have to sleep with it all night long.
Yeah, so it's called Cpap, continuous positive airway pressure. And so the machine delivers a pressure. We determine the pressure in another study where we determine what the best pressure is to keep your airway open. And that splints the airway open, and so that the airway remains patent or open all night, so the patient continues to breathe and then not have all these other problems.
So you're not actually giving the patient oxygen.
It's not oxygen, it's room air at a pressure. But some people have lung and heart disease, and some people do require that we what's called bleed in oxygen to the device. So we can add oxygen to it, but as a standard, it's just room air at a pressure to splint the airway open.
I read that there was another alternative to wearing that mask.
Yeah. And so this is, again, Cpap is the most ideal treatment, but we know that not everybody tolerates Cpap. So if we look at all the different studies out there, adherence or compliance to Cpap may be as low as 30, 40%. Some studies will quote 60 to 80% compliance. So we know it's not a one size for everybody. You'll talk to friends and family that use it, and some absolutely love it and say, I can't sleep without it. You talk to other people that it's so miserable to them that they are never able to tolerate. So we need alternative therapies, and we do have new alternative therapies. We have alternative therapies, and we can discuss some of those because we know that just because you fail CPAP, you still need to be treated, else you're going to have risk of daytime sleepiness that can lead to automobile accidents. We know it can put strain on your heart, and it makes diabetes difficult to control our sugar. So we have to treat it, and so then we have to move on to alternative therapies if a patient can't tolerate CPAP.
So this is something they'd have to discuss with their doctor.
Absolutely.
But if you go in and you have this study, you're sleeping in this laboratory all night long. Is it a comfortable bed?
Yeah, so we try to make it like a home environment, and so it's not...
Are you hooked up to...
Yeah. Yes.
Well, how can you sleep with things hooked up to you?
So right. People may have trouble, but what we see is, especially high-risk people that have sleep apnea, they can tend to fall asleep anywhere and sleep anywhere. But we have to put electrodes on the head to monitor.
You don't have to shave the head.
No, we don't shave the head. No.
Okay.
And then devices to monitor their breathing, like a cannula, belts across the chest and abdomen. So there are a lot of wires, but they can get up and go to the bathroom if they need to in the night.
Okay.
But we try to make it a comfortable environment.
All right. If you want more information on this, they can contact you at the Truman VA Hospital.
Yeah, we're happy to talk about alternative treatments. If you can't tolerate CPAP, they could contact the pulmonary office, 814-6000, extension 53363.
Okay, give that to us again.
Yep. The pulmonary and sleep medicine department would be 814-6000 and extension 53363.
Okay, for Truman VA Hospital. Dr. Jeremy Johnson, thank you so much for coming by. Pleasure chatting with you. I learned a lot today. All right?
Thank you.
We're out of time. See you next time. Bye-bye.